In today's Health Watch, the Biden administration wants to dramatically expand access to those popular weight loss drugs like, you've heard about it, Wegovy and Ozempic. Their proposal would allow millions of Americans covered by Medicaid and Medicare to be eligible for the drugs. CBS News medical contributor, that's Dr. Celine Gounder, editor-at-large for public health at KFF. Health News joins us now to discuss. Good to see you, Dr. Celine, always. Who would be covered under this proposal? We heard Medicaid and Medicare. Who is that exactly?
So until now, Medicare has covered people who have obesity and who also have cardiovascular disease or type 2 diabetes. Now you don't need to have those underlying medical conditions to qualify. Obesity alone is enough to qualify. However, being overweight and not obese would not be enough to qualify for coverage under Medicare or Medicaid.
Is there a certain age range? Is there a certain income range as to who gets access to this now?
So Medicare is people 65 and older for the most part.
Yeah.
Medicaid is based on your income. Are you low enough income? And depending on the state, that cutoff is defined differently.
Why do you think the Biden administration is proposing it now? And what happens when the Trump administration takes over, especially since RFK Jr. has said he's expressed skepticism about these drugs?
Well, this is really because we're recognizing that obesity is a chronic medical condition. Even if you don't yet have type 2 diabetes or high blood pressure, cardiovascular disease, if you have obesity, you are at extremely high risk for developing these medical issues. And so we see this as really trying to prevent head off some of these complications. So that's why this is being proposed now. Now, will the Trump administration follow through on this? We do not know. I think many people are looking for a silver bullet. The way I think about it is you need silver buckshot. You need to do a whole bunch of different things. So these medications are one part of it. Kennedy is right in saying that this is not a silver bullet. And he is focusing on another part of the puzzle. And in fact, the FDA, which will be under his purview, has proposed front-of-package food labeling to make it much more obvious to consumers what food is healthy or not healthy. White House still has to sign off on that, and then the Trump administration would need to follow through.
Yeah, well, it's hard to deny that they work because you look at the evidence is walking all around everywhere. Dr. Celine, thank you. Always good to see you. Happy Thanksgiving to you.